嗯，对，好，听到吗？喂喂，有声音吗？可以，OK。那我先回答一些问题吧。第一就是这个入路和框上锁孔入路的相比，直接来说就是镜框入路，跟框上锁孔入路那个概念是不同的。框上的锁孔入路是一个呃硬膜内的一个入路，是一个 intradural 的入路，它主要就是对应一些在前颅框底的一些肿瘤。所以这个金框入路呢，它比较多元化，它可以直接到这个中乳窝底，还有就是中乳窝，还有这海绵窦内侧海绵窦外侧的一些病变。框上锁孔入路是不能够直接到这个海绵窦外侧的，所以这两者是有分别的。那另外事件是 V2是不是断了海绵窦下阶打开了没有？V2 我展后我会展示一下，海绵窦我会做一个解剖，截骨大衣根部要磨除到什么位置？是框下的，对，就是这个截骨大衣的根部要磨到这个框下列的水平，是的。OK，好。I just want to can everybody just gather around a bit? Okay, I want to show you the cavernous sinus. I think some of you has already exposed the cavernous sinus. I think it's more important to know the approach, how to enter the cavernous sinus. So this is a V2. This is a tissue paper I just put in. As I said, this specimen is quite flimsy. The V2 is almost broken, but it's still okay. So this is a V2 anyways. V2. This is a V1. And here is the trochlear nerve, the fourth nerve. Again, V2, V1. This is a trochlea. And here would be the third nerve. And up would be the anterior clinoid. Now we want to do the approach to the cavernous sinus. So this would be the triangle that we want to go in between the fourth and the V1. The fourth and the V1. So this is the, what triangle? It's a Parkinson's triangle. So you see the dye inside, the blue dye. That is within the cavernous sinus. There's too much CSF coming out. So here we should be able to see the posterior genu of the carotid artery, and also we should be able to see the sixth nerve. Okay, so if there's a lesion, for example, in the cavernous sinus, like schwannoma, this corridor would be enlarged. You see, this is the upper limit of the V1. I'm now within the cavernous sinus. Go in more. So this is this sixth nerve. Here, you see? So the abducens nerve runs parallel to the V1, but it's just medial. So it travels posterior to the Dorello's canal, and medial to that would be the carotid artery. Okay. So this is the carotid in the medial. So this is the sixth. This is the V1. So here is the carotid, medial to this blue cast. This is the carotid. You follow the abducens nerve all the way posteriorly, you would reach a Dorello's canal. Which there is a ligament which forms the roof of the Dorello's canal. That is the Gruber's ligament. So now I'm doing the dissection along the course of the Dorello's canal. Small faucet, something like this, smaller. Small. Oh, okay, yeah. So with this approach, you can reach the lateral inferior compartment of the cavernous sinus. You see better now. So again, this is the fourth, the V1, 6. I just need to remove the cast very carefully in order not to break the nerves. So again, during operation, if there's a venous bleeding, what you can do is put a flow seal. So now after removing the cast, you can see an artery coming out from the carotid artery, a branch within the cavernous sinus. Here, you see outside? Yes. I think it's likely to be the infralateral trunk. This is the infralateral trunk. So it supplies the lateral wall of the cavernous sinus, including the V1. And here we see the carotid artery. So this is the anterior channel. And here is the roof of the Dorados canal, and here is the groovus ligament. You see the groovus ligament? The white tip thing here. So it's just formed the roof of the Dorados canal. So this would be a very good corridor to enter in the cavernous sinus with this Parkinson's triangle. The other triangle you can enter is via the V1 and V2. Especially for cases of a trigeminal schwannoma, because for trigeminal schwannoma, the tumor usually extrudes out from between the V1 and V2. This here. Here is another corridor you can enter into the cavernous sinus. But without tumor, this is smaller. So for pure cavernous, intracavernous sinus tumors, I would go through this corridor. This is a good surgical access. So this would be the access between the V1 and V2. So in this case, you can get to the inferior most compartment of the cavernous sinus. The cavernous sinus is divided into different compartments. There are a lot of trabeculations inside. So this is a 30-degree endoscope. I can turn the angle a bit and look inside. So here would be the compartment inferior to the abducens nerve. If I go through between V1 and V2, if I want to go through the Parkinson's triangle, the compartment of the cavernous sinus would be superior to the abducens nerve here. And here is the carotid artery. Now let's take a look at the third nerve. So this is the fourth. And so this has to be the third. So I think it's important to know this triangle, because when you attend courses or look at the surgical video, they always tell you there are different, you can see different cranial nerves, but very importantly, you need to know how to do it during surgery. The oculomotor triangle between the third and fourth is very small, so you can barely use it during surgery. Otherwise, you will run the